Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. Today we have renowned pediatrician Dr. Veena Tirumalachar, who is also a literary person who has written lots of books for educating the young mothers. And today she is going to tell us about the weaning of the breast milk. Dr. Veena, last time you told that the breast milk is the best one, the tailor-made, and it has got everything in it. And when the child grows up, when we want to wean out, how to wean and when to wean, with what to wean, please tell us.
Actually, when we say an infant is less than 1 year old.
Okay.
This is a very big transition phase. It is very important, the effect of which will be seen even at the old age also. So, baby has to adjust from the breast milk, which is given up to 6 months completely, to almost the family food at first year birthday. How does it adjust? What should we do? We follow certain rules. The first rule is we have to give the supplementary and complementary feed after 6 months, because breast milk is poor in iron content and a growing baby needs iron. So we have to give a complementary, supplementary food. And what we can give is the cereals and pulses, particularly mashed up banana. So which is very good for health. We start either ragi or rice, whatever the family uses, it in a porridge form in the after 6 months, or banana. But we should start only one thing at a time, one food, and that should be given in the morning food before 12 o'clock food, because by chance the baby develops colic, there will be somebody to attend to, instead of giving it in the night and struggling in the midnight and all that. So in the forenoon we give one dose, and that to start with only small 1 spoon, gradually increase it to 2 spoons. You give liquid in the beginning, gradually make it solid, and by 1 year we call it finger feeds. No, we can give like that. They can
like
pick up and eat something
semi-solid.
like semi-solid. So forenoon foods, one thing at a time, and after 3 days of trying one, or 3 to 5 days, you can start another thing, and gradually when we give 4-5 things, then we can give the mixture of things, complex foods we can give. But it is better to give always whatever is made at home, instead of getting it from the tins from the shop, which may have preservatives, which may have additives, which may have coloring agents, which may be rancid, which may be old, infested
and which
with
may
worms.
have even worms also. That is right. Now, many of the working women, they find it difficult. They say that it is difficult to prepare. Tell the simple way of preparing ragi malt at home, so that even working woman can do it and give the best food to the child.
A mother at home can prepare a shelf food by taking ragi or rice or dal, whatever she wants to use. Let her buy it from the shop and wash it well. After washing it well, let her aerate it so that it can become dry on a cotton cloth in the room temperature, whatever. And then she has to roast it. Roast it at a low heat
Fire.
for a long time. And after roasting, the ragi can be made it into puffs also. And then she can, in the mixie, she can make it into a powder, and then she can take that nice powder initially. Gradually, she can make coarse powder, nice powder, and she can hold it in a tin and put it on the shelf. Just use 1 or 2 spoons whenever is needed. So once a month she prepares, that's good enough for her. So like this, she can make shelf food at home easily, correctly, very hygienically.
Excellent. Do you think that adding ghee to it is better? Because a small child, the brain cells are growing in the first 6 to 9 months. And that is the time when it requires the nutrition, especially vitamin A, D, E, K, all fat solubles. They go very well with the ghee. So what do you say?
Adding ghee or even coconut oil is very good, because whatever we give, in whatever complementary food we give, it may be 2 spoons, but the calorie is less. only
Yes.
4.5 gram per gram, 4.5 calories per gram, whereas ghee has 9. These kids need calories. That is why adding ghee in addition to vitamin supplementation and in addition to its lubricating, in addition to the taste, it is
Yeah.
very, very good.
Very
We
good.
can definitely and should add.
And what about the curds?
Curds can be given because it's milk only in the another form with lactobacillus casein curds.
Partially
After 6
digested.
Yeah,
Yeah.
after 6 months you can give, but not before.
Yeah.
After 6 months, you can definitely give curds. It will be very good for the baby. So you know what they say?
Yeah.
The mother who feeds us is the natural mother. Cow is the second mother who gives
Yeah.
milk and we prepare curds.
Yeah.
And
Yeah.
Bhumita is the third mother.
Yeah, correct. Who gives the pulses and the right. And that's absolutely right. But only thing that the Jersey milk can have some allergy. Some children have the lactose allergy and then they will be out of it. And instead of that, the Deshi cows, the what we have our Indian cows, and that is the best for the children. And now I'll ask you the rapid questions. And please answer. Should the children be given chocolate or kal sakre?
Kal sakre,
Okay.
no
Should
chocolate.
should they give biscuits or the ragi malt?
Ragi malt, definitely. No biscuits with maida and sugar and soda, everything.
Okay. Should they give chikki when they grow up, one year afterwards?
Yes, after 20 months when the masticating teeth come, chikki, yes. And
Yeah,
chakli
chikki
also,
there.
yes.
Yeah, chakli and this thing that can be given afterwards. Okay. Should they give any bakery items or like a cake, or they should give the besan laddu, soft one?
Bakery items are not at all advised, not only for kids and infants, even for adults, because it has
Okay.
got very refined foods like maida. Even if they
Yes.
say atta bread, 90% maida only will be there.
Yeah.
So, and also they put soda and all that. So,
Yes.
bakery products, I never
Abba.
advise to anybody.
Thank you very much, Veena. It was so wonderful talking to you, and you have given such wonderful tips to the young mothers. Thank you.
Thank you very much.